Morning, everyone.
Morning, James. How are you?
Morning, Jim.
And welcome, Greg, and welcome, Andy.
Morning, guys.
And hi, Catherine.
Hi, everyone.
Thanks for joining. All right, are we ready to start? 9 o'clock. Thank you for joining. And this will be another remote connected session, so I appreciate everyone's time and efforts and hope that you and your family are doing well and that the holiday season goes as well as it can for you. And we look forward to perhaps a live session coming up with our summer meeting or our next meeting in 2021. In the meantime, thanks everyone for your hard work and your excellent efforts and then your outstanding work that you're doing with the community to help keep us safe and keep us warm and well. So call to order. Does everyone have, and thank you, Marie, for your help, and Stephen, in organizing the meeting. Everyone should have received the agenda as well as previous minutes and then other information that will go through our normal pattern. And please join in the meeting in terms of if you have questions, comments, and we'll do as best we can under the remote session that I'm sure we're all getting used to. So let's kick it off with a roll call. And I'll start with myself because I see on the screen, and then we'll just go and please announce yourself. If it's easier, I can call you out, but I think we can probably just do it if you can introduce yourself in some kind of order so that we can do the recording and Marie can make sure she has the attendance. So I'm Stephen Senor, the chair for the Dunn County Local Emergency Preparedness Committee, and also work at Cascades Tissue. And someone else would like to introduce themselves, please?
This is Steve Finlay, Dunn County Emergency Management Coordinator.
Thank you, Steve.
Kelly McCall, chair of Dunn County Highway Committee.
Okay, thank you, Kelly.
Kevin Big, Sheriff of Dunn County, law enforcement rep.
Thank you, Sheriff.
Cameron, Human Resources.
Thank you, Greg.
Jim Tripp, Dunn County Board Chair of the Judiciary and Law Committee.
Thank you, Jim.
Good morning, everybody. Brian Morris, your Dunn County Areas Races.
Thank you, Brian. Quentin.
Quentin Pop, Sand Creek Fire Department.
Okay, thank you, Quentin.
Representative Rob Summerfield.
You're up.
Jerry Leff, Dunn County Amateur Radio.
Thank you. Welcome, Jerry.
Hi, I'm Kristen Essick, and I am Safety, Health, and Environmental Manager for Phillips Medicize.
Welcome, Kristen. Thank you.
Good morning. My name is KT Gallagher. I'm the Dunn County Health Department Director.
Hi, KT. Nice to see you again. Who else are we missing?
Store Manager at Walmart.
Thanks, JP. Welcome. Thank you.
Andy Benrud, Menominee Fire Department, Battalion Chief.
Thanks, Andy. Thanks, Chief.
Jenny Legaspi with the American Red Cross.
Thank you, Jenny. Have we missed anybody? We get everybody?
Sorry, my internet connection is struggling. Kate Carlson with Chubb Global Risk Advisors.
Thanks, Kate.
Mhm.
I don't know if I
Already with Dunn
overtalked
County.
with the Eau Claire OSHA office.
Hi, Mary, welcome. Did we miss anybody?
I think Marie got stepped on there a little bit.
Okay, Marie?
Marie
Well,
Marty. Was in emergency management and I just moved over to the sheriff's office about 3 weeks ago.
Oh, okay. Thanks, Marie. Good luck.
hello, you may have missed me. I finally got this audio to work. My name is Greg Kaufman. I'm with Air Products. We have an anhydrous ammonia tank on site up in Boyceville inside of the ethanol plant.
Welcome. Thank you, Greg. Welcome. Do we have anybody else? Did we miss anybody? Okay, if not, thank you very much. And thanks again, Krista, for helping to set this up and for recording and for having this meeting set up the way you do. If you have your agenda, the next order of business is to review, if you haven't, the previous minutes. So we will do that. We'll take a moment to look it over if you have not done so. And after about another minute or so, I'll ask to see if there are any questions or comments. And if it's acceptable, we'll have someone make a motion and then have a second. So if you just take a moment to look over the minutes if you need to, and then when you're ready, someone can either ask questions or make a motion to approve.
Kelly McCullough, I would move to approve the minutes as presented.
Thank you, Kelly. All right, who was the second, please?
The Sheriff, Kevin Big.
Thank you, Sheriff. All right, motion passed. All in favor, and I'm not going to ask everyone to shout out. It'll be probably too crazy. So if you could just raise your hand if you approve, please. And you'll need your camera on, by the way. There we go. Opposed? Okay, a thumbs up would work just as well, or thumbs down. I'm probably doing a thumbs down on my role as a chair here, so it'll be like the Roman gladiators. Anyway, motion approves. Next order of business is the City of Menominee hazmat update or hazmat report. And Chief Benry, could you, or perhaps Stephen, could you take us through any updates with the hazmat, please?
This is Steve. Yeah. Tim sent over an email this morning. He wasn't able to make the meeting. He said that the department did a tabletop exercise in the last period here, trained enrollment exercise in a town of Rusk. And he also said that the fire department's purchased additional 7 hazmat suits of different sizes and also have replaced broken equipment for stopping leaks. And then they also picked up a new laptop. And it says, we are getting cradle points on our frontline trucks. And forgive me, I don't know what cradle points are. I did a quick search. The ones I came up with were Wi-Fi modems. And I don't know if that's what it is or not. Maybe Andy can help me with that.
What was your question there? Sorry, we had a call coming in.
Cradle points.
I'm sorry. Tim said you got new cradle points for your frontline trucks. And I don't know what those are.
Yeah, correct. So we just had cradle points installed in our 2 frontline fire engines, and that gives us internet access to laptops. So we had talked about this in the past. So we'll have laptops for pre-plans, facility that report. So greater capabilities to have that internet access right in our frontline fire engines.
So our offsite plans, then you can load those right on there and have access as you're going to scene or on scene.
Yep,
for.
sure.
Oh, okay.
Yeah, correct.
Right.
So either on en route or if we have a question when we get on scene, we'll have all that information right at our fingertips. So pretty important.
Yeah, thank you. Perfect.
Okay, thank you, Stephen. Any other updates?
That's the report. Yeah.
Okay, thank you. Any questions on the hazmat update? Hazardous defense update? Okay, if we could keep with you, Stephen, and go into the budget review, please.
Okay, on the budget report, I have no expenses to report other than wages and fringe for the period.
Okay.
Also, I guess I would also say at this point that the hazmat and computer grant has gone, work has gone in for the next year too. So we'll be able to start working on that for possible reimbursement down over the course of the next year.
Okay, great. Thank you. Questions at all on the budget report? Okay, if not, we'll go to the next order of business. If we could please keep with you, Stephen, and talk about the emergency information coordinators report.
Okay, I'll start with spill reports over the period from June, from our last meeting in June to now. And to start off with, there's a couple that started in the earlier period, but were closed out here in this period. And the main one was the train derailment we had in January. There was 670 gallons of diesel fuel that was used to cook in a couple of refrigerated train cars that derailed. That product, most of it dispersed upon impact, but a lot of it got on the ground. And over the course of the summer, they were able to, between the contractor and the railroad, were able to get it all cleaned up. And that case was closed out here just in October. So it took them almost a year to get that straightened up. There were some other issues going on there too, but so that one, the train spill site is all remediated and everything's back good to go. In March, there was a waste oil spill. It was actually an accumulation of oil, waste oil being placed in a tank, an above ground storage tank outside of the Kenworth shop up on 3M Drive there. That has since been fixed. They replaced the tank, put an indoor tank in, did some training of their folks, and then cleaned up the area outside where the spilled oil was being placed over time. So that activity was noted in March, but it was closed out here in September. The third one I have was started in June. It was at the 3M facility. It was a ethylene glycol spill from air conditioning unit, rooftop unit, I believe. It occurred in June, and it was finally closed out here in December. It was 130 gallons of ethylene glycol, and that one's been taken care of, totally taken care of. August, there was the truck fire in Colfax. A tractor trailer burned up, and in that course of that, there was some diesel and some motor oil that was released, but that was all remediated on scene by the towing company and the fire department. The Colfax fire took care of that, so that one's closed out right away. And a brand new one we have is December 4th. There was down in Rock Falls town at the countryside station. The transport was filling the tanks and released about 40 gallons of diesel fuel, and that's in the process of cleanup now. So that's the only pending one we have, the newest one right from December 4th. So that's the spills report. Claims, or any questions on that before I move on? Okay, any claims? There were no claims reported during the period. And so That's not an issue this time. The third thing I'd like to talk about is personnel changes. Jerry Leff from our Aries Races, our amateur radio group, has been on for many years. He's moving away from active participation in a lot of these groups, and we still certainly going to be in touch with his organization. But as an LAPC member, he recommended, and we concur, Marie and I concur, that Brian Morris would be a suitable and a wonderful replacement for him on our group. So, and he would fall into the Group 5 community groups, but as an Aries Races, as that potential for a communications backup, I think it would be a great fit. So I would recommend that to the group. And I'd also like to say at this time that Jerry's, over the years, I've been here a little over 3 years, and I've known them to be just an absolute wonderful resource to have, and a go-to guy that we've learned to work with in emergency management, and I wish him well. So that would be one recommendation. And then on the county board, Jim Tripp and would be joining. He joined the group last month, but he would be joining now the hazmat review committee, along with Brad Lutke from 3M would be our two new members to join with Tim and Kate and myself on the plan review committee.
Okay, thank you, Stephen.
Mm-hmm.
Any questions or comments? All right, thank you, Jerry, for all your years of service, and we hope that you can stay with us to attend the meetings and participate as you've done. Next order of business, if you look at your agenda, we have several offsite plans to look at, and we'll turn that over to the subcommittee. We have Anderson Consolidation Center. These are the update plans. Anderson Menominee, Menominee Wastewater Treatment Plant, and the Menominee Water Utilities 4, 6, and 8. So the 5 plans we have to review, excuse me, 6 plans we have to review. And Stephen, could I turn over to you, please, in terms of the subcommittee and or Maria, any changes that were made or any updates, please?
The only changes that Anderson Menominee, excuse me. Anderson Menominee had some occupancy changes to where they don't do a third shift now, and it goes with the business. And so their occupancy level is just a little bit lower on their first and second shifts. Otherwise, things are the same there. So Anderson Consolidated and Anderson Menominee, both the concerns are sulfuric acid, and that's the batteries in the tuggers and the forklifts. At the wastewater treatment plant, there was a phone number change, and that was noted in there. And in the water utilities, there were no changes. So the concern at the wastewater treatment plant and the 3 water utilities is chlorine. So if there was a release of chlorine, and that would be, we would get to a point where there would be a consideration for the weather and an possibility of evacuation or shelter in place. Those are the changes that we noted, and as the group, we sent these out remotely to have them look at them and get back to us with any feedback. That's what we came up with.
Okay, thank you, Stephen. Is there any discussion or questions on the plans? Kelly, you had a question?
Point of information, actually, globally for all the plans currently in the secondary emergency responders, Dodie Cockrum and Dolly Catlin are cited as Dunn County Transit, and neither of them are still with the county at this point. We're in the process of replacing Dolly, but I don't know who it is yet.
Okay, thank you. I'll certainly make a note of that, and I can get these 6 plus the rest of the balance of the plans changed on that. It's an ongoing effort for me to, and it's not a complaint at all. It's just it's just data management as I go in and I update things as I hear that. So that's great to know. Thank you.
Oh yeah, absolutely. I wonder if we can't figure out some way at the county into things to keep a list of the people who are county folks and let you know when those change. I'll talk to Paul Miller and see if we can't do something about that.
Okay, thanks,
That'd be great. It makes sense. Thank you. Any other questions or comments on the 6 plans? Discussion?
I'd make a motion to approve those plans.
Thank you, Sheriff. Is there a second?
Second.
Okay, thank you. And once again, either with your thumbs up or hands up or whatnot, if you would please vote to approve or hands down to disapprove. You can see 4 people. That's a good start.
Thumbs up.
Let's see. Everyone else looks good. Thank you. All right. Motion carries. Next order of business would be the update of the committee rules, the LEPC committee rules. And Stephen, would you mind taking us through that, please, or Marie?
All right, we have no proposed changes to the committee rules for this period.
Okay, great. Then we'll move on to the update on the spill reimbursement policy, please, Stephen.
Again, no changes are proposed by our group to those to that policy.
Okay. And in the past, we've talked about the next item, which is the designated or designate compliance inspector. Do you have an update for us with that?
In the bylaws, we've in the past designated the state Wisconsin Emergency Management as our compliance inspector, and we would recommend to continue that process to where if we have a facility that needs attention, we would call upon the state. They would send up an inspector and help us through it, and we would certainly accompany them and work with them and coordinate on that.
That's generally what we've done, yes.
Mm-hmm.
What would be the other option? To have somebody locally from the county, Stephen?
Yep. That would be.
And it depends on the county. They may choose that route or choose what we're doing.
Yes.
Thank you.
I don't know that they go to the extent of a contract person, an outsider that you might bring in. I think it's all kept within the county or within the state.
All right, depending on the resources of the county or their preferences. All right, thanks. Is there any discussion on that item, having a compliance inspector, or in this case, as Stephen was saying, relying on an outsider from another area of the state to come in? Okay, thank you.
Mm-hmm.
We do have the next item being the setting the meeting location. After we do that, I'd like to just open it up for any kind of discussion that we may have in general. So typically, our next meeting would be in June. And I don't know, Stephen or Marie, if you want to comment on that. Typically, it'd be the 3rd week in June, in June 2021. So if you want to look at your calendars, I don't have it in front of me here. We can, if you remember, those of us that have been on the board, we've had quarterly meetings, and now we've gone to semi-annual meetings. So based on the workload, based on the number of plans, activities, conditions, and situations going on, either in the county or in Wisconsin or further out, we can look at holding a meeting in March. If you feel that's warranted, we could certainly do that. If you remember, we had some discussions April, May during the pandemic when it was hitting hard. Now that it certainly is continuing that. Is there discussion if you feel we want to go on a quarterly basis, or do we want to keep it to semi-annual? So it's either going to be like a March, it can be any time, but typically it would be a March or June. Is there any discussion, or do you have any questions or comments on that?
One thing I'd like to share is that might be very timely for essential worker dissemination of COVID vaccination. And so there may be an opportunity to have that conversation here with this business group to talk that through in March.
Sure. That may make sense, KT. Any other thoughts from our members or guests? I propose then to support what KT says, and that is, let us look at, and certainly your participation like today is welcomed, absolutely. If we could go with let's put out the 3rd week of March 2021 as a meeting, and it could be relatively brief, and we could have an update like what KT's saying, county situation, and perhaps we might have a plan to review, Steve, or two, but if everyone is okay with that, let's go ahead and we'll schedule and we'll send out an announcement and update for you. Is that acceptable?
I have the third Thursday is March 18th.
Okay. I don't know if we need a motion on that per se, but if everyone is acceptable for that, we can put that on your schedule and we'll have something set up for March 18th.
Okay.
Thank you.
I can do that.
Great. Thank you, Stephen. So before we adjourn, and I'll just ask perhaps if anyone has questions or concerns that you would like to bring up.
Steve, Jerry left.
Hi, Jerry.
Honestly, it's been I think you're the only one in this whole committee that's been around at the LAPC longer than me. But it's been a pleasure, and it's been a pleasure and an honor to be a part of this group. And yes, I will continue being a part of the local emergency planning committee. Yeah, I'm sorry, through the amateur radio group. And Brian is I guess at my age, it's time to pass the baton and get more younger people involved and keep this whole operation doing very well. Thank you for the opportunity.
Thank you, Jerry. I certainly, on behalf of the whole committee, we are very proud of you and your contributions over the years. And I'm not sure if being around longer than you is such a good thing or not, but I'll let that one settle in. So thank you for what you've done, everything you continue to do. And we look forward to having your presence. And we're certainly working with Brian and help us to stay on pace and keep us in good order. How's that, Jerry?
That sounds like a tall order. I'll try. Thank you.
Somebody's got to do it.
Yes.
Other questions, comments? KT, could I pose on you perhaps, if you wish, to give any update? I know we have a subcommittee and a whole separate group that you work tirelessly on. Anything you'd like to share with the LEPC in terms of current conditions, situations at all?
Sure. So we are tentatively in a bit of a downturn in cases, which I'm grateful for. We had a couple weeks in November where we were averaging over 70 cases a day. And you guys will remember that anything over 12 was anticipated to overwhelm our systems. We have been sitting at about 20 to 30 for the last 2 weeks. And with the additional staff that I brought on for contact tracing, we've been very able to handle that. Yesterday, we did hit almost 45, and we're on par to do that again. So it's a little early to say whether or not that's a trend, but we did have schools go back into in-person session. And I'm wondering if there's a confounding variable with our school nurses being a driving force for testing, or if there's something else that we're not necessarily seeing that connection. We continue to not see student-to-student transmission within our school district, so that's always a good thing. So that's kind of where we are with cases. With hospitalizations, you guys will remember that hospitalizations follow cases and deaths follow hospitalizations. So we have had 20 deaths at this moment in time. We are continuing to watch for 1 or 2 more that we anticipate, but they tend to be a very arduous and drawn out process. Vaccination, you guys are aware that the Pfizer vaccine with its cold chain storage constraints has been put out into the hub and spoke model, with the state being very tight-lipped on where those places are. I'm sure you guys all know, but they do believe that there are credible threats to the physical vaccine as well as the infrastructure of vaccine dissemination. And so they are not identifying the large hubs where those vaccines are going. And that's about, within Wisconsin, 49,000 doses. We are waiting for the EAU, or emergency use authorization, for the Moderna vaccine. And we anticipate that that vaccine, 101,000 doses, will be disseminated later this week following that EUA, sorry. That is going to be targeted towards our long-term care facilities, workers and staff, where we have seen such infection and death. So it's really important that we cocoon and support our most vulnerable. Also expecting that 1B dissemination, where we see the remainder of frontline health workers and first responders and essential workers, that having a place for local public health to be more actively involved. 1A right now is primarily within our hospital systems, supporting their active vaccination of their frontline workers. And then we'll see that move out into unaffiliated first responders, EMS, with that kind of blending from 1A to 1B. What other questions do you guys have?
What would you see as a general distribution after the frontline workers, the elderly and so forth? And I guess anybody guess, KT, would you see this being the vaccines being distributed through, let's say, our healthcare chain or our hospitals, or more through the perhaps the Walgreens, Walmarts and so forth, that kind of network? Do you have any thoughts on that?
Sure. So when we have widespread accessibility, you will see your normal provider, Walgreens, CVS, that kind of thing, where you can get, for those folks that want to get vaccinated, to get vaccinated. I think that it really depends on how many of the vaccine formulations are approved and what kind of availability and just, sheer number of doses we have and how quickly, but it will be a ramping up definitely through the first quarter of next year, probably into the second quarter of next year, until we see more widespread distribution for everybody who wants one. It is a 2-dose vaccine. I'm sure you guys are all very aware, and it depends on which vaccine you're given as to how long you wait between that first and second dose, just like you would for many of the booster doses that your kiddos got, that you got. And so I think a lot remains to be seen based on what these efficacy trials look like and the authorization that moves forward. We are seeing really good efficacy in the mRNA vaccine. And there is some question about the more traditional vaccine technology. So for example, like Johnson & Johnson, what that's going to look like. But the more doses we have, the more folks we can get protected. But yeah, timeline, I think we'll know more. And the definition for essential worker is something that the SDMAC, the state is looking at to kind of take the ACIP recommendations and localize them to Wisconsin, looking at where our disparities are and where our greatest needs are. We should have more information on that within the next week or so.
Okay, thank you. And you mentioned certainly that the cases and the surge over the last now several weeks, if not months. How is that affecting the capacity of the local healthcare facilities in our county?
So I was in a meeting on Friday with our local recovery group and had the opportunity to hear directly from Mary Biggs and how it's impacting Mayo. We also put out a report kind of pulling together the publicly available hospital data and send that out to anybody that's interested in it. That shows that our hospitalized patients continue to go down. The available beds continue to go up, and we're really grateful. Mary also shared that Mayo, like Marshfield and Sacred Heart, are using monoclonal antibody treatment infusion to prevent hospitalization, and they're seeing really good local data on a reduction of anticipated hospitalizations in high-risk folks. So, that I'm grateful for. They're also being very creative, and I'm sure you've heard this, where they are hospitalizing people at home. Literally, they are sending a bed, hospital bed, all of the monitoring equipment to someone's home so that they are not taking a bed in the hospital, but are being cared for in their home. And then there's also that kind of middle ground for other folks that maybe come in for infusions of remdesivir, but otherwise can, and are COVID positive, but can be home. Whereas, 6 months ago, a year ago, it's really hard to even think about doing that outside of a hospital setting. So our hospital systems have been incredibly responsive, trying to meet the demand, and gratefully the demand has gone down over the last 2 weeks.
And certainly what we hear from CDC, from yourself, from the state, do you have any advice for, in general, that we can take to our employees or people we work with in terms of either when to get a test or when to come in for treatment? That I know everyone's out there, but do you want to share any of that, KT? Or not?
I think that everybody knows when to get a test, and we do continue to see mildly symptomatic people go to work, push through presenteeism, and really impact propagated spread within their workplace. So I would ask people that if they have any inkling that it is something that could be consistent with COVID, that they get tested. We continue to see atypical presentations in especially people that are 65 or better. And so, you guys don't want a noro outbreak in any of your facilities anyway. Vomiting and diarrhea is never fun, but it could be indicative of COVID. And so keeping that in mind. And then we are seeing people, have symptoms that start out fairly innocuous. They look a lot like maybe somebody's normal migraine presentation or somebody's seasonal allergies, but then by day 2 or 3 or 4, it's more serious. And so far, if you work 3 days sick, then you've actually exposed your coworkers for 5 days. We see very effective pre-symptomatic spread. And so just as soon as you have any symptom, go get tested, keep your workplace safe, and stay home when you're sick.
Great, thank you, KT. Any questions for KT or comments? Mary, I was going to ask you next, if you wouldn't mind. I know you just posted something here. Thank you very much, KT. Mary, would you like
OSHA,
to? Yeah, go ahead.
Hasn't come out with an official FAQ on if an employer can mandate a vaccination. But a number of articles have been out there that are pretty much on point. I did the Chicago Tribune one, I just sent that one, or in the process of. And that basically they can. And and we'll probably take the approach of the hepatitis B vaccination, where you would have a declination form that it's been offered to you and you can get it at other times. We haven't approached the pay issue. I assume if the employer is going to mandate it, then the employer is going to pay for it, but it's supposed to be free vaccination through the taxpayers, whatever the deal is. But it's still kind of new to us, and we're still rolling it around the national office. And again, we're going to go through administrative change, so there might be some different stuff there. Administratively, or OSHA-wise, there could be what's called an emergency temporary standard issued. Several states have done that already in North Carolina, California, Michigan, where they've said you have to have a COVID plan, and given some examples. So, the guess is change of administration. There probably could be this emergency temporary standard coming out very shortly after the inauguration. So that's what I got on vaccinations, or kind of where we're at. We are issuing lots and lots of citations on respirators in long-term healthcare, not doing the medicals, not doing fit testing. We're requiring long-term care facilities or healthcare facilities to document their burn rate of personal protective equipment if they think they're going to run out, if they go to the KN95s or a different or reusing. So we are taking the CDC guidelines and kind of using that as the basis for citations.
Makes sense. Thank you, Mary. Questions for Mary? And what Mary is saying is spot on. I have 2 facilities in Oregon, for example, and just like was Mary saying, Oregon being a state OSHA plan, they're required to have risk assessments and an infection control plan, a notification plan, and employee training. So I'm working with my facilities there. If you, our group, want any help with that, have a ton of stuff and can help send it your way or help you through this. It's not required in Wisconsin, federal, state, but it makes sense. So if that's something you would be interested in, Mary, thank you for all your service and your help too. Would anyone else like any questions? And thank you, KT and Mary. Any questions or comments that we have before we seek adjournment? If not, is there a motion to adjourn?
So moved.
Fair. Is there a second?
I second that.
Okay, thank you. Thank you, Andrew. And well, last time, if you would raise your hands or poke or do whatever for motion to carry, we appreciate that. Great job. So thank you, everyone. Thank you, Stephen, for your excellent job. KT, Mary, everyone on the call for serving our community as what you're doing. And Marie, for your excellent work. Please be safe out there as much as you can. Best wishes for the holiday season. And hopefully in 2021, we can continue our progress and get away from this horrible disease that has plagued us over this year. And thanks to everyone for serving our community and doing excellent work. Have a good day, and we'll